Welcome and thank you for joining us for today's webinar, Introducing a New Employee Assistance Program Built for ABC Members. I'm Derek Holt at ABC National, and I will be your facilitator for today's webinar. Today's presentation is being recorded and will last approximately 60 minutes. This presentation will be available on ABC's website within 24 business hours. Attendees will also receive an email with the link to the presentation and the webinar recording. As per ABC National's AI policy, the use of AI tools that record virtual meetings, such as this webinar, is prohibited. Please note all participant lines are muted. You are welcome to submit questions throughout the webinar by using the question box located at the top right of the screen. We'll get to as many questions as possible during the Q&A portion of the presentation. You may also minimize and expand the toolbar on the top right. I would now like to kick off today's webinar and introduce our moderator, Kelly Stewart.
Hi, thank you very much, Derek. Good afternoon, everyone, and thank you for joining us today. On behalf of the ABC Insurance Trust, I'm pleased to welcome you to today's webinar, introducing our standalone employee assistance program through TELUS Health, powered by the ABC Insurance Trust. At the ABC Insurance Trust, our mission is to help ABC members build strong, successful businesses by supporting their most valuable asset, their people. Employee well-being is a critical component of workplace safety, productivity, and retention. That's why we're so excited to offer this program as another resource for our members and their employees. While this standalone EAP offering is still relatively new, we just launched May 1, the response from ABC members has been outstanding. Today, the program already covers more than 800 ABC member lives, and the interest and engagement seems to just grow every day. It's clear that our members recognize the value of providing accessible support resources for their employees and families. We're fortunate to have Katie from TELUS with us today. She brings extensive knowledge of the services available through TELUS Health and will walk us through the program, its features, and how employees and family members can access this valuable resource. Katie, thank you for joining us and partnering with the ABC Insurance Trust to bring this important benefit to our members. We appreciate your time and expertise. And with that, I'll turn it over to you.
Great. Thanks so much, Kelly. And thank you, Derek. And I just want to emphasize what Kelly and Derek said. Feel free to put any questions in the chat. We do want this to be interactive, so please don't be shy, and we'll make sure that we get to those questions during the Q&A period. So as Kelly mentioned, my name is Katie LaCroix. I'm a director on our Strategic Alliances team at TELUS Health. What that means is I get involved when there is potentially hard to reach populations or more specialized programs that we're looking to put in place, which is exactly what we're going to be speaking about today. First, I will be providing an overview. TELUS may not be a household name, so I'll tell you a little bit about our organization, who we are, what we do, but most importantly, how we do it. And then really honing in on unique challenges that are faced within the construction industry. TELUS is a large organization with a very large roster of researchers. So we have some pretty compelling data to show you today. And then the meat and potatoes of the presentation, we will be talking about the tailored solution and how we've really customized and configured the employee assistance program through ABC Insurance Trust, specifically for the industry that you belong in. And then we'll talk about some next steps in pricing and how to get more information at the end. So who is TELUS Health? As I mentioned, we are a very large multinational organization. We operate in over 200 countries. We've got 142,000 employees. And we're really fortunate in that we've had a long, successful tenure in this industry. We're not a new provider. We have been in business as a global leader in mental health, well-being, and employee assistance programs for over 50 years. It actually says combined 90 years at the bottom of the screen there, and that's because we've done some pretty significant acquisitions over the last few years as well. And so gone through that post-acquisition integration phase. We're one big happy family. But a couple more stats that I wanted to point out there is really the size and scope of our network. And so we have about 180,000 master level therapists and clinicians and coaches around the world. In the US, and we'll talk about this a little bit more, we do have a network of about 74,000 therapists and coaches that can support you all. And the reason I mention that is it's all around easy access to care. We want to ensure that no one, if they decide to reach out for support, that they're not waiting, that there's that early intervention, early, very easy access to care, so that we can help people really do and feel their best. So I mentioned that I was going to talk a little bit about the unique challenges within the construction industry, because the construction industry is very different than, let's say, the education sector, and completely different than, let's say, healthcare, just to name a few. At TELUS, I had briefly mentioned we do a lot of research. We have a proprietary survey that's called the Mental Health Index, or MHI for short. In the US, we survey about 6,000 individuals every single month, and we ask them a series of questions related to psychosocial factors and how they're feeling, and everything that's going on in the world. And then we track those trends over time. From those trends and that data, we really try to identify certain insights and anything that could be impacting overall employee mental health and well-being. And then we benchmark it by industry. And so construction is, of course, one of the industries that we really do focus on. And we have a very large sample size of individuals that we survey every single month to see how they're doing, again, so that we can identify trends and insights. So what do we see when it comes to construction specifically? There is a high risk mental health of about 30% of the employee population, and that's compared to 23% of the general population. So the 23% is lumping and blending all other industries together and then comparing and contrasting with construction. You can see the stat there on the bottom. It's also higher for diagnosed anxiety and depression, with 13% of respondents from the construction industry with diagnosed anxiety and depression, compared to 11% of the US population. And so I'm sure that's not news or anything that this group of individuals hasn't heard before. Construction is a very demanding, difficult industry, and we're going to talk more about some of those unique challenges, but we thought the quantifiable and some of the research was compelling and interesting to share. Again, just looking across that risk stratification here. So you can see there's in red, that is our high risk versus moderate risk versus low risk. And when I talk about risk, these are individuals that are potentially more predisposed, or maybe at the risk of going out on leave or unable to do their job at work. So again, kind of take home point, I don't need to belabor it here. I think everybody understands that, unfortunately, the reality today is that some of the mental health challenges within the construction industry, self-reported by members who work within construction, are higher than the US general population. This just plots that over time, because we've been doing this survey from a couple months before COVID all the way through to now. And so the construction industry is the blue there on the bottom. And then what we do is we take all of those psychosocial risks, like the mental health risks that we just talked about, and then we look at how it can impact or impede productivity in the workplace. So again, here, that blue line on the bottom is productivity scores for the construction industry versus the general population. So there's a lot going on here. And one thing I really like to emphasize here is it's not just stats and words on the screen. It's your colleagues, it's your family, it's your friends. I'm sure everybody here knows somebody, either it's themselves or somebody around you, that is struggling with their mental health and well-being. And so I really applaud and appreciate everybody that's here today. And just, think of those people around you as we're going through some of the stats and some of the unique challenges here. So what else do we see? Construction is one of the most dangerous professions with the highest risk of deaths due to stress-related conditions. There is an increased prevalence of acute and chronic health conditions. The one on the right there, this one is always, difficult to say, and that suicide rates, especially in male construction workers, are more than 4 times the national average. There are other industries that I'm aware of and that I present on sometimes where it's higher than the national average. It could be 2 times, 3 times, 4 times is the highest that I've ever seen from our mental health index and the research that I do. And so, of course, being here and talking about how to support individuals is incredibly important. Accessibility, availability, and acceptance of reaching out for mental health support. And that's why I'm going to talk about our network, and I'm going to talk about all the ways, modalities that are available, or ways in which individuals can get in touch with us for support. And then, one of the pervasive challenges that we see too is that mental health concerns are often seen as temporary issues. You'll feel better the next day, go home, get a good sleep, have a beer, whatever it may be, you're going to feel better. Quite often that's not the case, right? And as just like physical health, right? If somebody has a sprain or a strain or a stress fracture or something, the longer that you go untreated, the worse that physical condition is often going to get, right? And so mental health is no different. If somebody is struggling, it's not just about getting good sleep. They often need professional help to be able to work through to overall healthier well-being for themselves. Just one more slide on this, and then we're going to talk about the components of the program and what we can do to support. But the two here that I find really interesting is that workers in the construction industry, again, that fill out that mental health index survey, self-report that they feel that their workplaces are not psychologically safe. You know, there's a saying in the mental health industry, like, it's okay to not be okay. And unfortunately, that isn't something that we're seeing as much as we should be seeing in construction. A lot of people do suffer in silence because they don't feel it is psychologically safe to reach out for support or to disclose that you may be struggling with a mental health condition or substance use disorder or whatever it may be. And that I think these really go hand in hand, but there is a lack of trusted personal and professional relationships. But it's not all doom and gloom, because what we do see, because we have so much data, and our data scientists really help us collate all this together, is that the organizations that implement mental health support, employee assistance programs, when you compare and contrast to organizations that don't, all of those MHI scores that we just talked about, they go up. Right. And so there is good news here. It's just about building the awareness around a program. And we find the programs that get the most utilization and the most engagement and just overall positivity are the ones that are specifically tailored to the population. As I mentioned before, the way that a nurse would want to engage and receive mental health support is going to be very different than, let's say, a crew leader, which every single day they're on site at a job site responsible for 10 people on their team. Those two individuals, the way that they need mental health support are different, and therefore we really need to provide those tailored solutions. And so huge kudos here to the ABC Insurance Trust. We worked incredibly close for a quite a long period of time so that we could really come up with a program design that was going to be most beneficial to you all. And so this is very high level, kind of 50,000 foot view of the main components of the program. And then we're going to peel back the layers of the onion, go a little bit deeper on a few of them. So kind of nucleus core of an employee assistance program is your short-term solution focused counseling. Now we're 24/7 in everything that we do, 24/7, 365. It could be 2 a.m. on, New Year's Eve, and somebody wants to reach out for help. Not only will we be there to support them, but it's not an AI, it's not a chat bot. It is a live person who will be there to support you. Our work-life services, that's kind of an umbrella term. So there's a couple of really important services that are part of work-life. We offer for members of that have access to our employee assistance program, or EAP for short, free legal consultations, free financial consultations, elder care support, child care support, and community referrals. I will go into some more specific examples in a few slides, but that's all under the umbrella of work-life services. The platform itself, so when I say platform, I mean both access to our website and our mobile app, is chock full of digital entry points and additional resources. I'm actually going to show you a demonstration of the website today, and I think that will be much more impactful than me just describing words on a screen here. So I won't go into too many details, but kind of some of the top key points for you to know when we're talking about the TELUS Health One platform is that it again is 24/7. So we have an online chat feature. Anytime, any day of the year, you can reach out. Again, it's not a chatbot, it's a live clinician, it's a live human in one of our care access centers that you'll be able to access. There is self-scheduling or online scheduling available online, and then a ton of other resources as well. There's, short assessments if you want an assessment with personalized recommendations. There's self-guided programs. Some people, the thought of reaching out and vocalizing or saying what you may be going through, it could be somebody who's going through a divorce. It could be somebody who's in debt. It could be somebody who is grieving. Sometimes it's very difficult to say those things. And so we offer self-guided digital programs as well. They're based on the principles of cognitive behavioral therapy. So it's exactly what somebody would experience, but just without the human component. So it's self-guided, and then you can always have therapy sessions from there if that would be of interest. We have dedicated crew leader support. So these are unlimited consultations if, and it's a specialized team on our side that has that skill set to support crew leaders, because we know they have a difficult job. They have their own stressors, and then they have the compounding stress of all the people on their team that they're responsible for as well. So there's a lot there on that screen. That was the kind of speed dating version of this slide, but we're going to go into a little bit more detail on a few of the important components, again, that we heard from ABC Insurance Trust, that they really knew that we needed to have these in place. So one is our clinical first approach. So there's a lot of mental health providers out there that are either, digital only, or they might be digital plus some in-person components or some human components. But if you were to call in, it would be a client care representative or kind of like an intake agent or customer service agent that would pick up the call. What we are doing differently for this program is a clinical first approach. What that means is any chat that comes in online or any phone call, not only is it answered by a human, but it's answered by a master level clinician, therapist, counselor. It all kind of means the same thing. This is somebody who's gone through extensive training and is a licensed counselor. It could be a licensed social worker, it could be a psychologist. We've got all the different credentials in our network. So the take-home point there is when you call in, a clinician will answer that call. What we see is on average, people when they call in, they spend about 24 minutes on that initial call versus industry standards about 10 minutes. We know it's because they're receiving that in the moment support. Again, a lot of time there's still a lot of stigma associated with reaching out for help. And so it takes a long time for people to kind of finally say, like, I'm not okay, I do need some support. So when they get that in the moment support and they're speaking to a mental health professional in that very first interaction, it's quite impactful. A stat that you don't see on the screen there that I think is really important to mention is the follow through rate. So industry average, you usually see about 50% of people will go to that next appointment, right? So they do their intake, 50% of people show up to that appointment with a counselor. With our model, we see 75% of people show up to that next appointment. That's a whole 50% increase, right? If you go from 50% to 75%. And I always liken this to physical wellness. If you have two people that are going to the gym and one's going to the gym 50% of the time more than the other person, of course, the person who's going 50% of the time more often is going to be in better shape. They're going to have better physical gains. Again, mental health is no different. And so we find our health outcomes, the efficacy of the program is a lot better because of that 75%, which is attributed to the clinical first answer model. Somebody calls in, they have in the moment support, they develop that therapeutic relationship, they see benefit in the experience, and then they're more likely to continue on with their sessions. When I mentioned sessions, that's an important point of the employee assistance program, is that there are a lot of different EAPs that operate with different session models. A 3-session model, a 5-session model, a 6-session model. Those are very common. What that means is, let's say it's a 5-session model, it would be up to 5 sessions per presenting issue per year. We did away with that here for this program. We've launched a clinically appropriate model. That means that there is no predefined cap on sessions or limit on sessions. It's whatever is clinically appropriate for that individual at that time. So somebody could call in on a Tuesday, maybe they're struggling with their crew leader or they're struggling with one of their colleagues on the job site. That could be work-related stress. They may only want or need, 1 session, 2 sessions. Let's say that same person or a different person calls in on a Thursday and there's been a death in the family, or they're really struggling with a substance use disorder, or they're going through a divorce. All of those examples are what we call presenting issues, but they have a higher acuity and higher severity of need. So that individual will probably need 6, 7, 8, 9 sessions, and we will provide that to them. So just to summarize, the clinically appropriate model is very flexible. It's really rooted in working through to case resolution and finding a solution, and there's no arbitrary session limit. So it's quite flexible. Again, something that doesn't say on the screen, but I do want to mention is eligibility here. So not only does the employee have access to everything that I've talked about, but the employee's spouse or partner, household dependents, anyone in that household that would want to or that does have a need for support, they can reach out and receive support as well. And it's not like a shared allotment of sessions or anything like that. We just provide a very comprehensive model. So the eligibility extends not only from the employee, but to their family members as well. The size and breadth of our network, I hit on this really quickly on that first slide. We are the world's largest employee assistance provider. We do have a lot of bench strength and a large roster of clinicians. You can see some of the specialists that we have on the right-hand side of the screen there, but we do have over 74,000 counselors. And so sometimes I get asked about, how quickly could someone get an appointment? So when the call first comes in, again, you were speaking with a clinician that very first call, receiving in the moment support. From there, if you want to continue on with ongoing counseling, because we have such a big roster and network of clinicians, you'll be offered an appointment in 2 to 5 business days. I say 2 to 5 because we triage based on severity and need. The ways in which to reach out to the program, we call modalities, just ways that you can connect with us. We do have the most available in the marketplace today. So it probably sound like a broken record, but I think it's important just to underscore 24/7, 365. Individuals can call in. You can have video counseling, in-person counseling. And we really focus on meeting people where they are in a way that's comfortable and convenient for them. Some people, I have a daughter who goes for counseling. It was really important that she met with her therapist in person, face to face, make eye contact. Other people, that would be incredibly intimidating and a huge barrier to reaching out for support. For those individuals, you can have a telephonic session, a video session, really whatever is going to be most comfortable and convenient, we will offer. I like that chat there in the middle, the 63% of new users who have engaged with our chat feature self-report that they would not have reached out otherwise. So a lot of people find it, more comfortable, more convenient. Actually heard a story the other day. I've been with this organization for 8 years, but it was our SVP of research who shared it. So I know it's factual. The very first person who reached out through the chat function was an individual who was in an abusive relationship, abusive situation. And they couldn't pick up the phone and call in because the fear of their abuser hearing them. So they reached out through chat because that was easy and that was safe for them to do so. So we're really proud of all the different modalities that we offer. I had mentioned that I would share a little bit about the different work-life consultations that we offer. So you heard me say we offer free legal consultations, financial consultations, elder care, child care support, and community referrals. This is not an all-encompassing or exhaustive list. There's more that we can help with, but these are some of the general examples and really the top reasons why people reach out to us for these consultations. So I won't read all of them. You can kind of see them on the screen there. As Kelly mentioned, we will share this presentation afterwards, but a feedback I often get is that people don't really understand how comprehensive the program and all the different ways that we can help. And if you need support with something and you have access to the EAP and you don't see the bullet there, just call us. Sometimes people don't know what they don't know what they need. That's our job, to help peel back the layers of the onion and triage you and help with all the different things that we potentially could help for. So an example of that, someone may call in and say, I can't sleep at night, I'm stressed. Our job is to really understand, okay, well, why is this individual stressed? In this example, perhaps they are, their father or mother broke their hip. They live a couple hours away. This person's the only adult child who's now in a caregiver position. It's a very stressful situation, but in uncovering and understanding why that person is stressed because of this new elder care need that they have, we can not only provide the emotional support and the counseling, but then also the elder care support component as well. So oftentimes people are struggling with something. It might be multifactorial, and we can provide support in multiple different ways to them. Our workplace learning solutions, these are add-on services that are available. We have a very large catalog of learning options. These are just, again, a couple examples that might be more relevant to this audience. And we're pretty flexible. We can do it virtually. We can do it on site. Typically we find, 30, 60, 90 minutes is the typical allotment of time, but we're really flexible and can ensure that we're designing a facilitated learning program if that's of interest to any group. A couple more examples here. I mentioned our catalog is long. If anyone is interested in seeing all of the different programs within the catalog, we can always share that with you. This one is really important. It is our critical incident stress debriefing services. It's quite a mouthful. CSID for short is what you may hear about sometimes. What it is if there is a traumatic event that has happened in a workplace, doesn't even actually have to be in a workplace. It could be separate from that. But let's say there's just to rhyme off a couple examples. It could be a death, could be an employee homicide, suicide, natural disaster, large scale restructuring in the workforce, robbery, any of those type of traumatic events. What we can do is very quickly deploy trauma counselors. Again, could be virtual, could be on site, could be across multiple sites, to provide that critical incident stress debriefing. So really helping people process what they've experienced and help them get to a place where they feel confident and comfortable in going back to the work. Unfortunately, we have a lot of experience in this area. Pretty much every day, we're getting a call about a critical incident. And so we do over 10,000 events per year. And so, rest assured, if there ever was something that any employer group or anyone on this call, if there was a traumatic event, you can always reach out to us and we could provide this level of support. It is usually fee for service on top of the employee assistance program, because it's more ad hoc in nature. So it's the most economical way to bake it in. So from here, we are doing excellent on time. I'm going to actually switch out of this presentation and take you through a demonstration of the platform so you can see all of the different features that are available to you. So the only step that you would have missed that I just teed up before being in front of all of you today was signing into the platform. And so signing into the platform is really easy. We create a shared username and password so everybody can sign in through the same username and password. Then once you're in, we prompt the user to create a personal account so that everything is confidential to them. I should mention that as well, the topic of confidentiality. It's the cornerstone of our business. Everything is confidential. We will never tell an employer, anyone from ABC Insurance Trust, we are not sharing any information about individuals who are reaching out for support. We provide reporting back that just says how often is the program being used, but that is all de-identified and aggregate. We are very, very strict on all of our confidentiality and privacy rules. So no one will ever know. The only time where that changes is if there is a duty to warn, if there is a very dangerous situation, someone's disclosed to us that they are contemplating suicide or homicide and we need to call in emergency services, we have a duty to warn. We would do that, but otherwise everything is confidential. So once you sign into the platform, this is what you see. The Connect with Us, this little purple feature up here, you're going to see that on all of the pages. We make it really easy for people to know where to go to find the phone number and the other modalities. So you can see here, schedule an appointment. This is to access the online scheduling. Live chat, 24/7, 365, click to call phone number. It's all right there, very easily accessible. If I scroll down the page here, featured resources, this is maintained by our content management team. So if there is something going on in the world or there is a specific theme that month, it could be Men's Mental Health Awareness Month or Heart and Stroke Foundation Month, whatever it is, we're going to drop content on that topic. So it's always kept hyper relevant and up to date. And all of our articles are designed to be short and sweet. We call it snackable. It's meant to be consumed in about 3 minutes or less. So you can see this one here is quite a short article, because we know there's a lot of competition for attention these days and there's a lot of noise on the internet. So we want to make sure that it is easy to consume. All of the content is indexed as well. You can see here the sub-pillars of well-being: family, health, life, money, work. And then you could click into those. But if you don't want to poke around or click on the site, you can always type in a keyword, which will pull up resources within the platform that contain that keyword. Obviously, anxiety is a broad one, big one. So there's 244 results here, but we know that everybody does have different learning preferences. And so we have those short snackable articles. We also have videos. We have audio files. We have toolkits. We have infographics. Toolkits I often get asked about here. And this is really a compilation of different resources around a specific topic. So for example, we'll look at the Addiction and Recovery Toolkit. Has a lot of great information. This information is either authored by our subject matter experts, our psychologists, our clinical social workers, et cetera, or it's been clinically validated. So it's all factual, it's all good information. These toolkits, you can click through to all the links or download it as a PDF if it's something that an individual wants to share internally or more broadly externally. We allow that as well. If I go back to the library here and I scroll down the page, there's other really helpful links that are embedded within the platform here that individuals can click into to find, K-12 school search, for example, legal forms generator. If you're looking to do your will and last testament, you can click in here, get access to all those forms and all good, really, really good, helpful information. If I go over to CarePath, this really houses two main features within the platform. We've got our Care Now. Those are the self-guided programs that I had mentioned before. So sometimes this is a really nice entry point and people want to engage and kind of start slow when it comes to mental health and well-being. This would be a great place to start. We've got 22 programs. This number is constantly growing, and you can see some of the topics here. We really base these topics and these programs on what we're hearing from our clinicians in the counseling sessions. So whatever is most prevalent, we will build a Care Now program for it. So here you can see anger management. If I join now, it's going to present me with my path. So all the chapters. And as I mentioned, this is based on cognitive behavioral therapy. So it's developed by experts. And it makes sense to go sequentially from 1 to 2 to 3 to 4. But if you don't need to, it's kind of choose your own adventure. So if I just wanted, I had 4 minutes, I've never done a guided deep breathing exercise and this interests me, I can go ahead and click into it and access that. And then, like I said, we make it really easy to connect in with care, have that human intervention if you need to. So you'll continue to see that Get Help Now feature. The other feature within this section of the platform is our total well-being index of assessments. So these are behavioral-based assessments. As you saw, there was financial, social, physical, and mental wellness. They're very easy. We take that same snackable or short and sweet approach here. So the way that I'm answering the questions here, based on my financial circumstance, would of course be different than, let's say, how Kelly or Derek would fill out theirs. So once I click through, what I really like about this is it gives me immediate feedback specific to me and how I answered those questions. So you can see this risk stratification. So am I at risk health or optimal health when it comes to my financial wellness? Tells me what I'm doing well, but probably more importantly, what I could do to improve. So based on how I answered those questions, I guess I said I'm not saving for retirement. I don't feel confident with my level of financial literacy, and I'm not saving for retirement. So it's giving me this personalized and prescriptive feedback. And then it gives you what I call a data-driven action plan. So it's taken all of my feedback that I gave based on how I answer those questions, and it's giving me recommendations that are specific to my circumstance. So because I said I'm not planning for retirement, it's now serving up a short article on ways to save more for retirement. I've got my financial well-being toolkit. I might even recommend a financial consultation through the work-life services that we talked about. So it becomes very, very prescriptive and really helps drive incremental change. Because we're on the topic of financial wellness, you just saw a financial literacy tool and recommendations. We've talked about free financial consultations with professionals. Fun part of the platform, we have perks and savings as well. So perks and savings help stretch your hard-earned dollar a little bit further. It's what it sounds like. It's a discount at point of sale. We have a lot of them here in the platform, but really, if there's something that you find that you're interested in, you click into it, it presents a discount code, or you hit get deal, and then that will be inserted when you go to the website to check out. We found this is a really nice carrot that draws people into the platform as well. A lot of people will want a perk or saving. They'll come into the platform, they'll find it, and then human nature, once you're kind of in the solution, then people oftentimes will poke around. So if a perk helps somebody start on their well-being journey, then we see that as a huge positive. Okay, so I'm going to go back to the presentation now, just to kind of tie things all together. So you should be seeing the right screen here. So ABC Insurance Trust is offering and extending a discounted rate. So all of that information you can see here on the screen in terms of what the per employee per month cost is. And to lock in the discount, there is a QR code. So I'll leave this up here for a minute. Anyone interested can go ahead and click on that. And maybe at this point, Kelly, I'll pass it over to you as well. If there's anything you want to say about the discount or how to get in touch moving forward, or any just general comments, that would be great.
Absolutely. Thank you, Katie, so much for providing that background on why we need the program and how to utilize it. And again, as I said, I'm super excited that we're able to offer this to members. And as Katie mentioned, we're extending the discount that's originally due to expire tomorrow, but we're going to extend that to the attendees of this webinar because we understand your time is important and we appreciate you joining us today. So if you need to reach out, we're also going to be sending this out after to all the registrants of this webinar. So you'll be able to have that QR code readily available to you where you can reach out and get in touch with us, and we'll get back to you right away and discuss how we can implement this program for your employees. From here, Katie, unless you have anything else, I think, you know, as we mentioned before, we've already got 800 lives enrolled and we just started May 1. So it's hit the ground running, a lot of interest. We're working with ABC National to integrate it into a lot of places in the STEP, possibly in the STEP program and the safety, the workforce development, because it just makes sense. The mental health goes along with safety at sites. So we appreciate, we do have a question and we did want to open it up to questions as well. So we do have one that's already in there that says, if you already have an EAP program, can this enhance your current benefits? I will say absolutely to that, because most likely you have an embedded EAP plan that is offered through a medical coverage or another type of employee benefit coverage that you have. And so it is minimal, and it most likely is minimal. As Katie mentioned before, there's session limits and things. It's really just an introductory type program, those embedded ones. So this absolutely stands outside of your health plan and can be an additional piece to enhance your current benefits. Yes, Kieran. Any other questions you guys might? And that's we already offer at the Trust an embedded program, but that program, you know, is just a start. And that's why we were working with TELUS to create this specifically for ABC members, because it's much more robust, stands alone, offered outside of your medical plan, and has clinicians ready to help right at the initial call. We've got another question. What strategies do you use to increase employee awareness and engagement? Well, I'll let Katie chime in a little bit on this, but we do at the beginning an onboarding part. We provide a lot of resources that can be sent out electronically, can be housed on your intranet, can be put in your office poster. We've got wallet cards that we provide as a resource so that, you know, these folks have the information right at the ready and they're able to reach out when the time permits for them. Katie, do you have any extra additional information on that?
Yeah, we do a lot of promotion about the program. We try not to make it so that you're doing all the heavy lifting. We have a well-being calendar, full 12-month calendar, where we make a lot of recommendations of how to build a culture of well-being, and then we plot it all out in every single month so we can share that with you. We have newsletters as well. It's called the Heartbeat newsletter, so individuals can subscribe to that so that they're getting kind of frequent information about different spotlights in the program. How can we help individuals? That frequent reminder, kind of a drip campaign to say, this program exists, here's the benefit of it. So we do have those newsletters, and then we can do orientations also. So quite often groups, when the program is starting, or it's a new open enrollment period, or whatever it might be, we can do individual employee orientations. We can also do orientations that are specific to the leaders or managers or crew leaders. That's such an important role in organizations, because oftentimes managers are the ones that observe an employee might be struggling, or an employee discloses to their manager that they do have something going on. So their role is really important. And so we have special orientations that are designed and crafted to really help that manager understand the program for all of the people they're responsible for, but also for themselves. So lots of different materials exist. And then we can always give recommendations as well. We see, we have some clients of ours that have much higher utilization than others, and it's usually when there is that well-being culture. So oftentimes a top-down approach where there's an executive who's willing to talk about their experience with mental health or anytime they've used the program. So we can kind of come in and consult and provide recommendations to each individual group as well to say, here are best practices, here are the materials we can give you, but then here are some additional ideas that you might want to contemplate and execute on your own within your organization.
Absolutely. Thank you, Katie, on that, because I wanted to touch on the crew leader support, and you did that because obviously if you're engaging the crew leaders are engaging the staff. So I think that component, which was built in, specifically for ABC members to support the crew leaders that have so much on their plate every day and understand how they can help, it will absolutely increase engagement. And we're here at the ABC Insurance Trust to help at any point, to do any presentations. Maybe you want to do something, once a quarter or something like that to keep, employees engaged. We're happy to help. So absolutely, I appreciate those questions, and we'll continue to answer them if you have them after the call as well. We're here at any time to answer those, and we will send this out so that you guys have the contact information to get a hold of us. All right. Katie, anything else to close out today?
No, just my deep appreciation and gratitude. Thank you so much for joining and engaging in a very important discussion about mental health. And again, I would just say, think of your colleagues around you, think of your friends, think of your family. There are unfortunately a lot of people who are struggling and don't always know where to go to for help. And so, hopefully we can all be part of that solution.
Yeah. Thank you, guys.